Remember, 1 teaspoon of salt is equal to 2000 mg of sodium, and that is the maximum allowed per day. Welcome to the weekly dose of self-care presented by your neighborhood pharmacist. Today, we're going to talk about the second part of reducing your blood pressure in just 6 simple steps. We're going to talk about the one that has the most impact on your blood pressure. It's going to be about your dietary pattern, and the diet we're going to talk about is called DASH diet, which stands for Dietary Approaches to Stopping High Blood Pressure. If you're able to follow the DASH diet, then you can decrease your top number of your blood pressure by 11 and the bottom one for roughly by 5. Here is an example of a DASH diet that will give you roughly 2000 calories. Essentially, the good things about DASH diet is that it is low in salt, rich in fruits, vegetables, whole grains, low-fat dairy, and lean protein. Basically, it's a healthy way to lose weight because it's high in calcium, potassium, magnesium, and fiber. And when all these are combined together, they'll help lower blood pressure. Feel free to pause the video to look at the serving recommendations per day. Controlling your alcohol intake also has a difference as well. If you're a heavy drinker, if you're able to cut down by 2.7 drinks per day, then you can actually lower your blood pressure by 4 for the top number and 2 for the lower number. For women, it is recommended not to have more than 1 glass of alcohol per day. And for men, nothing greater than 2. The other thing is that people often think that I don't drink every day, so it's okay for me to binge drink, which means basically they'll drink a lot of alcohol just for that day and they think we'll be fine. But it's actually not. Binge drinking is actually more harmful than drinking a little bit every day, just because our liver is only able to metabolize so much alcohol per day. So once you exceed that limit, it actually causes liver damage, which is very likely in the case of binge drinking when you drink too much. So it is okay to drink, but you need to control the quantity that you take in. Stresses could come in many forms. It could be mental stress, physical stress, or work-related stress. It's very important to be able to reduce your stress or control it because it does have an impact on your blood pressure. If you're able to reduce your stress, it could result in a lowering of your top number of your blood pressure by 6 and lower by 4 for your bottom number. There are many stress reduction methods out there. It could be doing yoga or deep breathing exercises or doing meditation. The point of these methods is to kind of distract yourself, let your body focus on something else instead. Now you know all these 6 simple steps to lower your blood pressure. Here are some over-the-counter medications that you need to avoid so you don't end up increasing your blood pressure. The first one we're going to talk about is a common scenario when you might have a stuffy nose. So when you have a stuffy nose, you might be tempted to buy something called Advil Cold and Sinus because it has a medication component that will help with the stuffy nose. But if you have blood pressure issues, it's better to use a nose spray like Ultravent or Hydrasense to help with the stuffy nose because it doesn't affect the blood pressure. The other common scenario is when you have pain in general. So when you have pain in general and you have blood pressure issues, then it's best to avoid Aleve or Advil. The best one to use instead will be Tylenol since it doesn't affect the blood pressure. If you have any feedback or comment about the channel, please comment below. Otherwise, please like and subscribe and turn on notification. And I'll see you next Saturday at 8 p.m. Bye!